Hi everybody. We have a case of 50-year-old male who gives history of a long-standing cough associated with purulent copious sputum, and this sputum production was more in the early morning, and also the sputum production increased with change in posture or bending forward. On asking his past history, he gives a history of childhood pneumonia, and followed by which he developed on and off cough as well as recurrent respiratory tract infections. And in the recent past, in last 1 year, he had 1 or 2 similar exacerbations which required antibiotic therapy, and 1 to 2 episodes of minimal hemoptysis was also there. In view of all these symptoms, he was started on inhaled bronchodilator, but he did not show any significant improvement. When he presented to the emergency department, he was having mild tachypnea with a saturation of 94% at room air. On auscultation, there was coarse crepitations in bilateral lower aspect, that is in the infrascapular and infraaxillary area. And on general examination, it was found that he had clubbing in his fingers. So blood investigations revealed mild leukocytosis. Chest X-ray was ordered, which showed dilated ring shadows or tram track appearance in bilateral lower zones, for which the HRCT thorax was ordered for further evaluation, which showed cystically dilated bronchi in both the lower lobes of the lung, and few of them showed air fluid level. So the CT and the HRCT and the chest X-ray showed cystic bronchiectasis in this patient. So the question was, which step is the most essential step for the long-term management of bronchiectasis patient? So according to the BTS and the ERS bronchiectatic guidelines, if you see, the important or the cornerstone step in the management of bronchiectasis is airway clearance technique. So any patient who has mild to severe bronchiectasis should be taught airway clearance technique in the form of chest physiotherapy, postural drainage, or using of PEP devices, or breathing exercises. Because if you ask the patient to clear the airways, it will break the vicious cycle of bronchiectasis and thereby reducing the frequent exacerbation as well as the destruction of the lung, and the quality of life will also improve. When you see the other options like nebulized antibiotics, they are used only when you have a documented chronic colonization with Pseudomonas aeruginosa, because it will affect the mortality and the prognosis. And the next is long-term macrolide therapy, which is advocated in patients who are having 3 or more exacerbations in last year despite optimum treatment, which is not there in our patient. And surgical management is reserved only for localized bronchiectasis. So the answer is the airway clearance technique. Thank you very much.